Food and eating. This section pertains to food and eating in regards to someone who has Alzheimer's disease. Make mealtimes calm and comfortable. During the middle stages of Alzheimer's disease, you need to limit distractions and don't have too many food choices. They often have changes in perception, taste, and smell, which make eating more difficult. The following tips can help. Limit distractions. Serve meals in quiet surroundings, away from the television and other distractions. Keep the table setting simple. Avoid patterned plates, tablecloths, and placemats that may confuse the person. Using color to contrast plates against a tablecloth or placemat can make it easier for the person to distinguish the food from the plate or table. Consider using a plastic tablecloth, napkins, or aprons to make cleanup easier. Provide only the utensils needed for the meal to avoid confusion. Distinguish food from the plate. Check the food temperature. A person with dementia may not be able to tell if something is too hot to eat or drink. Always test the temperature of foods and beverages before serving. Offer one food item at a time. The person may be unable to decide among the food on his or her plate. Serve only one or two items at a time. For example, serve mashed potatoes followed by the main entree. Be flexible with food preferences. It is possible the person may suddenly develop certain food preferences or reject food he or she may have liked in the past. Allow plenty of time to eat. Keep in mind that it may take an hour or more for the person to finish. Eat together. Give the person the opportunity to eat with others. Keeping mealtime social can encourage the person to eat. Keep in mind the person may not remember when or if he or she ate. If the person continues to ask about eating breakfast, consider serving several breakfasts. Juice followed by toast, followed by cereal. Encourage independence. During the middle stages of Alzheimer's, allow the person with dementia to be as independent as possible during meals. Be ready to help when needed. Make the most of the person's abilities. Adopt serving dishes and utensils to make eating easier. You may serve food in a bowl instead of a plate, or try using a plate with rims or protective edges. A spoon with a large handle may be less difficult to handle than a fork, or even let the person use his or her hands if it is easier. Serve finger foods. Try bite-sized foods that are easy to pick up, such as chicken nuggets, fish sticks, tuna sandwiches, steamed broccoli, or cauliflower, even orange wedges, or make a meal in the form of a sandwich in order to make it easier for the person to serve him or herself. Try hand over feeding. Demonstrate eating behavior by putting a utensil in the person's hand, placing your hand around theirs, and lifting both of your hands to the person's mouth for a bite. Don't worry about neatness. Let the person feed him or herself as much as possible. Set bowls and plates on a non-skid surface, such as a cloth or towel. Use cups and mugs with lids to prevent spilling. Fill glasses half full and use bendable straws. Minimize eating and nutrition problems. In the middle stages and late stages of Alzheimer's, swallowing problems can lead to choking and weight loss. Be aware of safety concerns and try these tips. Prepare foods so they aren't hard to chew or swallow. Grind foods. Cut them in bite-sized pieces, or serve soft foods such as applesauce, cottage cheese, or scrambled eggs. Be alert for signs of choking. Avoid foods that are difficult to chew thoroughly, like raw carrots. Encourage the person to sit up straight with his or her head slightly forward. If the person's head tilts backward, move it to a forward position. At the end of the meal, check the person's mouth to make sure food has been swallowed. Learn the Heimlich maneuver in case of emergency. Address a decreased appetite. If the person has a decreased appetite, try preparing some of his or her favorite foods. You may also consider increasing the person's physical activity or plan for several small meals rather than 3 large meals.